So, no, I wouldn't say I have a passion for HR.
Welcome back to Human Resources for the People. It's a human capital revolution. The biggest strike in healthcare history started today, and we've got to talk about this. Right now, it's a 3 day strike, may extend to longer, but several thousand employees from Kaiser Permanente took on strike. They're part of the coalition of Kaiser Permanente unions. Let's set the scene real quick before we get going. Kaiser Permanente is a large integrated healthcare system and managed care organization based in the United States. It's one of the most prominent healthcare providers in the country, providing a unique model of healthcare delivery, combining health insurance, medical care, and a network of hospitals. Key components are that it offers health insurance plans to its members, and those members pay a monthly premium for the coverage. Integrated care, it owns and operates its own hospitals. It has group practice models with physicians, nurses, specialists, and other healthcare professionals working together as part of a cohesive team. And we also have to, with this, talk about their union and their labor strategies. It's one of the largest unionized healthcare providers in the nation. It's a massive union, and it's a coalition of Kaiser Permanente unions, which is a group of unions that unites 85,000 members. So they have quite a few. OPEIU, which is the Office and Professionals Employees International Union, Local 2 out in Virginia, the same one out in Washington and Northern California. Hawaii's Nurses Association, which is Local 50 out in Hawaii. SEIU, which is the Service Employees International Union. That's a massive union. They have quite a bit of locals or chapters in throughout the Kaiser Permanente system, including Local 49 out in Oregon, 105 in Denver, 121RN out in Southern California, and then a few more in California and Washington. So we're talking a very comprehensive and integrated group of unions throughout the Kaiser Permanente system. But Kaiser Permanente's approach to labor relations is really interesting. They have a commitment to collaboration and partnership. It's not about zero sum. It never has been. It really is honestly win-win. One of the most significant aspects of Kaiser Permanente's collaborative approach is the Labor Management Partnership, or LMP, started in 1997. That is a groundbreaking initiative that brings together labor union and management to jointly address key issues from patient care to employee satisfaction. It's characterized by shared decision-making, open communication channels, and a focus on mutual goals. This means that Kaiser Permanente has a culture of trust and respect, generally speaking, among itself and its labor unions. It's a very holistic approach to labor negotiating, and Kaiser Permanente has often been applauded and awarded for its approach to labor management partnership, to working with joint labor management committees where employees have a say in the matters that affect their work environment. So, it's a very forward-thinking organization, Kaiser Permanente is. However, the unions, the coalition of Kaiser Permanente unions, is arguing that they haven't been bargaining in good faith. They want to be taking care of patients, but they just can't because Kaiser can't hire enough employees. With the staffing shortages, pregnant people in active labor can be stuck waiting for hours, allegedly, in California in the Kaiser Permanente system. Here, the Kaiser Permanente unions are mostly looking for more pay, staffing, and workplace health and safety. Right now, the union's looking for a $25 hourly minimum wage, as well as 7% increases in the first 2 years, and then 6.25 in the 2 years after. What I think that is interesting is that Kaiser has proposed minimum hourly wages between $21 and $23 next year, depending on the location. And that comes on the heels, right, of just a couple of days ago, the California Governor Newsom signing a $20 minimum wage in fast food. So would you go work in fast food with limited responsibilities, certainly not caring for the life of another human, and make $20 an hour, or care for the life of a human, probably have a significant amount of education that you've paid for and other certifications, and make $21 to $23? There's some serious wage compression happening. And of course, the minimum wage announcement out of California, which directly affects most of these employees, didn't happen. Now, they are looking for staffing. I did want to highlight the fact that, just a couple years ago, just in 2021, The coalition of Kaiser Permanente unions agreed with a mandate for the jab on August 21, and they had a deadline for August 23, 2021 to provide proof of that jab, or they would be allowed to resign in lieu of termination. If they did not have it, they would be put on unpaid leave effective October 1st, 2021, until they got the jab. Those people all could be working, alongside, and perhaps, quite possibly, there wouldn't be any staffing shortages, which allegedly came as a result of the burnout from COVID and how busy they were. Let me know what you think in the comments down below. Will this impact your care? Are you expecting to see delays if you're visiting Kaiser Permanente hospitals? Let me know. Like, share, and subscribe, and we'll see you on the next video. Bye, guys.